Qualitative methods are a good starting point when you begin your assessment. Methods such as observations, meetings, focus groups, expert consultations, and one-on-one interviews can be useful for describing a situation and can provide insight for your intervention approach. You can find more information about each of these qualitative methods at samhsa.gov, or you can contact your community support specialist for specific resources. Quantitative methods are useful in that they often take less time to administer than qualitative methods. They are also easier to evaluate and may produce clearer, more objective results. Quantitative methods include record reviews, surveys, and archival trend data. A record review is a gathering of data from pre-existing records and usually takes the form of statistics that was previously collected for other purposes. Surveys must be correctly designed and administered to ensure an acceptable degree of objectivity. Archival trend data already exists. These are national, regional, state, and local sources, such as data compiled by law enforcement agencies. There are a variety of resources available specific to Kansas quantitative data. Ask your DECA community support specialist for support with specific quantitative data needs. Collecting and gathering data to use as evaluation measures should not be an overwhelming process. You most likely already maintain program records and have some data available for evaluation purposes. As you determine the evaluation measures you wish to collect, it is important to keep a list of all resources and data sources that are already available to you. Creating this inventory will help you determine what information you have and what information you need or want to collect. Data can help you identify where improvements are needed. Determine how effective changes improved your implementation. Encourage and motivate staff to make improvements. Provide fiscal accountability, and improve public relations by providing information. Evaluation data should be examined on a regular basis. The evaluation results are used to improve programs, sustain positive outcomes, and improve a community's overall plan for addressing substance abuse and promoting wellness. But they can be used for other reasons as well, such as to help obtain funding or build community awareness and support for prevention. There are many ways you can put your evaluation results to good use. They can be used internally to help make decisions regarding your programs in the future, and externally to inform the public about your organization and the work you do, as well as the prevention needs and goals in your community. It is important that the coalition and the community know what the purpose is regarding the work of the coalition. Understanding what the intended outcome goal is targeted will make it easier for the coalition and the community to celebrate success. Reporting evaluation results is a key step to celebrate outcome successes. When providing reports or presentations, there are several tips that may help communicate your message. Keep tables simple. Too many lines, groups, or patterns can look confusing. Make it black and white friendly. Could someone still understand a photocopy? Give it the glance test. Can the casual reader understand a table or chart without additional explanation? Highlight numbers and statistics with direct quotes from a focus group. Present data in more than one way. 2 in 5 high school students might be more impactful to parents than saying 40%, even though they mean the same thing. Use section headers and chapters. Breaking up a report into themed sections can make it more flexible or user-friendly. Be consistent in your formatting and fonts. Too many fonts or too much formatting can be tiring for the reader as well as confusing. Use grammar and spell check. Spelling mistakes, incorrect grammar, and punctuation look unprofessional, and the audience will begin to distrust the presentation. A few more tips to help you feel confident when reporting your evaluation data. Use quotes. Put your key findings that you wish to highlight in a text box and then bold them. Use the 6 rule. Try using no more than 6 lines on a slide and use phrases rather than full sentences. While some animation can be helpful, too much animation can be distracting. Using a variety of coloring in your presentation can be fun, but confusing for some coalition members and stakeholders. Some color combinations may represent specific events or context and distract audience members from hearing your evaluation results. Passing around visual aids permits those that are listening to focus on the visual aid rather than the speaker. Remember to always give credit to where you found the evaluation data that you're reporting. Practice before presenting your data reports, and that will help you to feel more confident with the material that you're presenting. Avoid using fancy language, cliches, jargon, and acronyms. If there's a simpler way to say it, use it. Remember that acronyms have different meanings in different organizations. Part of every stage of the strategic prevention framework process are the concepts of cultural competence and sustainability. These two concepts should initially be incorporated into each stage and help guide you in all areas of the process. Working towards sustainability as you progress through each phase of the strategic prevention framework takes a lot of intentional effort, but it is well worth it and can make all the difference in the success of your efforts. Evaluation plays a central role in sustaining the coalition's work. Evaluation enables you to take key pieces of data and analyze and organize them to have accurate, usable information. Applying cultural competence to each step of the strategic prevention framework benefits many aspects of your coalition's work, such as an increased awareness about the unique challenges and advantages within the communities you serve. Your relationship with members of the community also improves when you affirm cultural perspectives. Mutual respect, understanding, and acceptance of how others see the world are critical to the successes of the coalition's evaluation effort, particularly in culturally diverse communities. Your coalition puts a great deal of effort into implementing evidence-based prevention strategies in your community. Now that you've completed your evaluation plans, you have committed your coalition to learning about what has worked well in your community and to pinpoint areas where you want to make changes and improvements for the future. You have also put into place the foundation for your next needs assessment and ensured that the strategic prevention framework process of data-driven decision-making to promote effective prevention is sustained in your community. Your community will thank you for all the hard work both now and in years to come. Additional resources to enhance your prevention work can be found on the Kansas Prevention Collaborative website. Here are a few links to resources that can help your coalition plan for sustainability. Thank you for viewing this webinar and best of luck in your sustainability effort. Thank you for your time, and if you have any questions, please contact your DECA Community Support Specialist who can provide technical assistance or training.